Our patient came through our emergency department suffering from a massive heart attack. What we basically found is that our patient had a very unique kind of anatomy that is very extremely rare.
Originally, we thought it was just a normal routine heart attack, but once we got into the case, we were able to see the patient's different anatomy and how much he really had going on.
So they get me in the ER, and Dr. Al-Khatib comes in and says, "We should be done in 15 minutes. We think you have a blood clot." 3.5 hours later, I see him and his assistant give a high five. I said, "All right, what's going on?" He said, "We're going to talk to you and tell you." He comes up to me and said, "We pulled 7 blood clots out of your heart."
In his situation, we realized that he had a complete blockage in all 3 major arteries. So as soon as we realized the severity of the situation, we had to be creative and get to work. It's such an honor to work with the UPMC. It's been really such an amazing experience for me to be part of this team, and I'm very proud of our team, what we were able to accomplish.
It was great to be able to have the equipment and the staff to be able to work with on this. And we kind of went from there, and we were able to save his life.
Today was an exciting day here in Erie at UPMC Hamot. UPMC Children's is now at Hamot. UPMC Hamot has been providing pediatric care, but we want to expand it and elevate it so that we can keep kids closer to home.
It's really life-changing for families that need to see specialists frequently. Not having a burden of a 2-hour drive, possibly hotel rooms and other expenses. They can come here to a familiar city so we can keep our kids here and decrease the stress on our families by having our specialty clinics.
The presence of Children's Now really is a whole continuum of care, from pediatrics in the emergency room to outpatient services and now inpatient services. And so the good news is, regardless of the level of care that children need, we're able to provide it now at UPMC Hamot in collaboration with our partners at UPMC Children's.
The new expanded 9-bed inpatient unit looks and feels like a pediatric unit, all private rooms. And I know our patients and families will be very thrilled if they have to get admitted to the hospital that they will be taken care of in a pediatric-friendly environment.
Today at UPMC Jameson, we are hosting a robotics event for our local high school students. We are expecting over 10 local schools, which amounts to about 300 students.
The idea of this presentation is to introduce the robotic technology for the high school students and for the community, try to put them involved with this new and fantastic technology that we have available. So doing that, maybe we can promote the idea that, oh, I can actually follow this career and stay around the area once I love the area.
I would say that today's experience has definitely motivated me to enter the healthcare world, an industry I've been incredibly interested in for the past few years.
And it's great to be here because it's fascinating to see how much STEM is taking part in health. I love the thought that I can create tools, but also help people, but also continue on with that engineering process.
The intent of this event was to expose and inspire our local high school students to pursue a career in healthcare. So we wanted to do this in a hands-on, interactive, fun-filled educational environment.